So traditionally the telehealth service has been of invaluable help to overseas travellers. So we now have a number of Australians who are stranded overseas and unable to return to Australia. So they can use the telehealth service to both contact their own practitioners and also to have care provided to them through Australian medical services. People who are in isolation, either because they've been in contact with the virus or they actually are infected with the virus, can use that service as well, and we'll be providing that service to corporates and to hotels and to mining companies so that they can keep their operations running without having to bring their personnel back into close contact with other people and putting them at risk of infection with COVID-19. So in those situations where you want to keep people isolated for reasons of maintaining their safety, telehealth provides a very valuable capability for routine healthcare. In addition, the telehealth service is going to be invaluable for the population who are actually infected with the virus, in that both in terms of being able to access their healthcare practitioners and also being able to then be monitored. It will provide a comprehensive range of services that mean that those patients can be helped at the sort of scale that's going to be required in the near future. So we've seen telehealth in its infancy in Australia until the last couple of days, when suddenly it's leapt into prominence, and the new MBS item numbers now have made it available to all practitioners in nearly all circumstances. That's going to mean a huge change in how care is provided. And hopefully we will see what happened in Canada, where with the introduction of telehealth, there was actually no change in cost to the national budget, but a huge benefit to patients in terms of not having to travel as much, and also reductions in costs from travelling to healthcare environments. We haven't really seen that in Australia in the past because we've had problems in terms of one jurisdiction paying for travel and another jurisdiction paying for the consultations. Hopefully those barriers will be removed once people can see huge benefits that arise from using telehealth in a more sophisticated way.